This Wednesday, sponsored by Baptist Health.
Well, we're starting to see some of the hottest temperatures so far this summer, and Austin has mentioned more heat is on the way. Doctors say extreme heat can become quickly dangerous, putting stress on the heart, lungs, kidneys, and brain. So, who is most at risk and what should families watch for? Joining us now is Baptist Health cardiologist Dr. Scott Davis. Kayla was just talking about this, how these heat waves can really impact our construction workers, but I mean, it can impact anyone.
Yeah, so it's a perfect segue into this whole medical segment. And first of all, let's talk about how it happens. What happens with the body when the heat goes up? So Austin talks about heat indexes. That's the feels like temperature. So when we see the temperature of 95 degrees, well, heat index can be over 100 degrees. And the way that impacts the heart is the body wants to cool its core, and so it will shunt. It will dilate blood vessels so that blood will then move out into the periphery so that we can then offload the heat in the core of the body. And so blood vessels dilate, and that puts more work on the heart to pump blood. Then you compound that with sweating, losing fluid, so then your volume goes down that's circulating, and it puts even more work on an otherwise stressed heart. Then if you're at risk as far as you've got blood pressure medicines, previous heart disease, you're on a beta blocker, you're on a fluid pill like a diuretic, like a water pill, then that can make the situation even worse. And so we always want to tell people, look, know what your risk is first. Second of all, then, those that are most vulnerable, as we kind of talked about in the earlier segment, include, construction workers, outdoor workers, but then also the elderly, folks that live alone, folks that have previously documented heart issues, either a stent or bypass surgery or heart failure. And so we want to encourage people then, know what your risk is, but here's a key thing too, know your medications. And so I tell patients, if you're on a beta blocker, if you're on a diuretic, don't stop your medicines as we go into these summer hotter months, but definitely you want to talk to your doctor, your cardiologist. Do you need to have a personal, summer specific plan going into the summer for your water pill therapy, your diuretic medicine? Talk, if you've got heart failure, talk to your heart doctor, talk to your cardiologist as far as any kind of tips and then guidance that you might have.
Okay, so what are some things that we need to look out for?
So I think we got some screens here. First of all, if you're having issues with circulatory collapse, any symptoms that need to be that you have don't need to be ignored. If you develop sudden fainting, dizziness, loss of consciousness, shortness of breath, inability to breathe, certainly if you get an absent pulse, but then as these symptoms progress from, a heart issue or a heat issue to a heat stroke issue, things like cold, clammy skin, which is kind of the opposite of what you start thinking about, temperatures that get over 103, and then confusion, nausea, vomiting, again, passing out, that's 911 kind of stuff.
Right.
And so the thing, too, to emphasize along with these symptoms is check on neighbors, check on elderly neighbors, check on loved ones, especially elderly loved ones that may live by themselves.
Yes, and of course our kids and infants as well.
Absolutely.
Dr. Davis, always a pleasure. Thank you so much for explaining all this for us this morning. And of course, if you want to get in touch with Baptist, just go to their website or give the call. That information is right there on your screen.